Which of the following is used to treat a patient referred to physical therapy with a diagnosis of Dupuytren's contracture? A. Knee continuous passive motion, CPM. B. Work simulator set for squatting activities. C. Hand splint. D. A 2-pound dumbbell. And the answer is C. Hand splint. Explanation for this question is: Dupuytren's contracture is a hand condition that involves the thickening and tightening of the connective tissue beneath the skin in the palm and fingers. Treatment for Dupuytren's contracture may involve physical therapy, medications, or surgery. A hand splint is often used in physical therapy to help stretch and mobilize the affected fingers and hand, which can help to prevent further contracture and improve hand function. Knee continuous passive motion, CPM, and work simulator set for squatting activities are not relevant to the treatment of Dupuytren's contracture. A 2-pound dumbbell would also not be helpful in the treatment of this condition. For more learning, Dupuytren's contracture, also called Dupuytren's disease, Morbus Dupuytren, Viking disease, and Celtic hand, is a condition in which one or more fingers become permanently bent in a flexed position. Dupuytren's contracture happens when the tissue under the skin near your fingers becomes thicker and less flexible. The exact cause is unknown, but it's been linked to having a family history of the condition. Smoking.